Hello, everyone. We're live again. Sorry for the technical issues if you've been joining us in the previous recording. We had to switch over our streaming platform, but we're here now, and that's what matters. So I'm just going to restart what we were talking about, and I hope you'll just bear with us so that we have it for the recording. If you don't know, I'm Adam. I'm the president of Nurse Recruitment Experts. We've been working in rural healthcare since 2019, primarily in workforce, public health communications, and tech innovation projects. And since 2022, we've been blessed to work in Alaska. So we have a partnership with the Southeastern Alaska Regional Health Consortium, and we've helped them hire doctors, nurses, and physical therapists. We're really passionate about helping Alaskan organizations really use this $272 million Rural Health Transformation Program grant for the benefit of your community long term. So with me, I'm very happy to have my colleague, Dr. Michael Fitzmaurice, who is our partnerships manager, and he's been speaking to a lot of organizations in Alaska about this grant. Do you want to introduce yourself, Dr. Fitzmaurice?
Sure, yeah. So it's good to be here. So yeah, my background is peripheral nerve surgery. I had a retina issue, so I don't operate anymore. Just really concentrate on metabolic health. But I have always dealt with people from rural communities, even based in Arizona. I was getting people flying from Alaska for specialized care. So I'm well aware of the issues going on. I've talked to rural providers, and I know the struggles that they go through. And so when this opportunity came about to be a part of this, jumped on it. I was very excited to help a lot of these communities with the issues they were having in a perfect time where they can get these grants and either expand on projects that they're working on, or they have some really great ideas to help transform healthcare in these communities. And this is giving them the opportunity to do so.
Yeah, it's really a once in a lifetime opportunity, isn't it, for providers to make a difference, and particularly for kind of startup projects and new initiatives to get the funding that they need to kick off. We're really excited to be helping 5 or 6 providers write their application and supporting them in implementing their project. There's one of the ads we made for search, by the way. Really like bigging up Southeast Alaska, beautiful location. And what we do as an organization is help healthcare providers build programs that then they can use to go out and win rural health grants. So we've helped partners win about $1 million of these types of grants. And we help them build a program. So bringing in Dr. Fitzmaurice's clinical expertise, my background in recruitment and marketing, help build a program that can operate efficiently, sustainably over time, be it creating a new workforce center and training staff to become CNAs or nurses, or introducing an ambulance to a remote area. We're helping providers really take their vision and turn it into a fundable proposal. And then whenever they launch it, we help with communications and getting the workforce to actually come in and staff the project, and conversion. So how do you actually take someone from interest in working with you to being a full-time employee, or getting a partnership with a local hospital to invest in your project and work with you? And I want to just make it very clear that in this, I'm not the state, okay? So Dr. Fitzmaurice and I are helping various providers write this. We've won a lot of grants like this, and we think that we can give you a third-party, openly biased and opinionated look at winning these funds that you can't get from the state. The state is going to be your fount of knowledge for all the rules and what you ultimately can propose and what you can't propose. We want to fill in some of those gray areas, like how do you write so you can win, or how do you design this program so it stands out against the competition, because we're foreseeing that this could be quite a competitive application. So we've made a little resource that I'm going to promote to you all before I jump into some of those opinions. And this kind of goes in line with our first piece of advice to you, which is don't just go on to the state's application form and start filling it in before you've had the opportunity to collaborate with colleagues and partners. So we made this resource for everyone. It's literally the same as the state's application form for the letter of interest, but it's on a Google Doc. So you can download this as a Word doc if you prefer. But having this enables you to put in comments, delete things, change things as you go through ideation stages and filling out your proposal. And we find it very useful with our clients so far. So on my profile or around this video somewhere, I'll be putting the link for this. And if you don't see it, you can just ask me for it. Collaborating remotely is huge and going to be beneficial for anyone who wants to win this, because this is what the state wants to see. They want to see really regional collaboration. They want to see healthcare providers bringing in different partners that are working together to change the system long term. They want something that's going to be sustainable for 10 to 20 years, not just run out of money whenever the grant program ends. So I wanted to ask Dr. Fitzmaurice, is there any particular partnerships that you're seeing flourishing or are growing out of the clients that you've been talking to?
Yeah, I mean, there's certainly some relationships being built with organizations like local hospitals to fill in certain needs, working with certainly the tribal communities to fill in needs there. And then, ideally you get a couple people with good ideas on different spectrums, and you realize that they can partner together to make even a better, stronger partnership and letter of interest there. So there's all kinds of great ideas and partnerships developing. And that's why we are communicating with all these different groups. And when you communicate with us, we may align you with other people that we've been working with, and we feel you might have a stronger partnership together to obtain your goals.
Yeah, absolutely. So going to go into a few little thoughts and ideas to kick us off. The first one is a question on how much to bid for. So it isn't clear what the maximum award they're going to give or the minimum award. And I think the question is, well, how many awards is there going to be and how much should providers bid for? Let's say there's 1,000 applicants. If you split the 270 million pot on an average basis, then that's 270,000 average award, which is quite a hefty sum compared to a lot of other grants that have came out in rural health in the past 5 years, at least. Now, I don't think there's going to be 1,000 applicants that go for this. So whenever they did the RFI, there was 160 respondents. And on the announcement webinar for this letter of interest, there were 2,000 attendees. Now, they're not all going to be from 2,000 different organizations, and then you're going to get people who drop off through the consideration or application process whilst they're thinking things through. So obviously go for whatever's an appropriate amount for your program, but don't limit yourself to a small amount because of what your current resources are, because you can fund in bringing new staff members that will help oversee this program, or you can engage a contractor like us that can handle a large chunk of it for you. Don't let internal capacity kind of hold you back from applying for this. This is really not going to come round again. So what we're saying, the people that we've spoken to, I think the minimum, Dr. Fitzmaurice, is 200,000 of the small organizations we've spoken to. Is that right?
Yeah, typically that's the lower end. And then obviously some are going more in the 300,000-400,000 range, depending on what the goals are and what they're looking to achieve. But typically nobody's going to apply for something less than 200,000. Yeah.
Okay. And if you have questions, kind of programmatic questions, I found that this is the best document. The state has been really good on their website for, here it is, putting information there. But there's so much of it now that it can be a little bit hard to understand where to look. On this page, you can find this recap of the RHTP letter of interest officers, where you can see everything that you need to know kind of programmatically about the the letter of interest. This cannot be stressed enough. You need to go and get this UEI before you apply. So look up sam.gov UEI how to, and follow the instructions there to get a UEI. That's very important. And whenever it comes to writing your proposal, I really wanted to go over this because this is the foundational matter here, where think about how this. So there's 3 different organizations involved here that are kind of stakeholders in this program for you. So you have the Alaska Community Foundation, who are really managing the grants and overseeing the implementation of the program on behalf of the Department of Health in Alaska, who are overseeing this on behalf of CMS on the federal level. Because there's so many layers, it's really crucial that you fit into their categories, and you can show how what you're proposing lines up exactly with what the federal level ultimately wants to see, because they're the ones handing this money down the chain. So a lot of people have been asking us, well, I know what I want to do, I know what I need to pick up on in my community, but what I actually say. And really, it's important to center it around one of these 6 categories. So whatever you're proposing to get funded, it needs to fit into one of the Rural Health Transformation Program goals and initiatives. So these have been approved by CMS, and we're in Alaska's application. And if you want to find out more about these, then you just need to go on and look at the state's application to the program. So just Google it, Alaska Rural Health Transformation Program application. You'll see this PDF, and then you can come down to the 6 categories. So this is a strong area of expertise for us, strengthening workforce. And we're working with a home health agency that want to hire more staff, and have pointed them to consider really centering their proposal around this category, for example. So in the writing that they're doing, they're saying we're going to fund or expand training and workforce development in this area for these positions. Dr. Fitzmaurice, have you seen anyone taking this approach, doing it right, and how are you helping people visualize what they want to do within one of these?
There's a range. Some people come with a really good plan. Other people have a goal. I want to do this for my community, and we have to help work with them on how are they going to achieve that. Other people already have it laid out. I want to look at this and this. So there's a wide range. So some people have really good intentions. They see a need in the community. They have a background in something, and they'd like to work on that. And then we have to refine their goals with the guidelines, initiatives that are out by the state. So there's definitely a range, and we work with all sorts of groups, large and small. I mean, we're talking about single practitioners to large organizations who have many people involved. So we've seen and worked with everybody.
Yeah. But that's the secret to winning. So as I was flicking through my slides there, everyone, you might have saw a picture of a chihuahua. So let me pull that up for y'all. Chihuahuas are growing on me recently. I don't really like them, but I have recently seen some that I liked. Anyway, a big thing in writing proposals is the difference between compliance and responsiveness. So I would say that compliance begins, responsiveness wins, and you don't want to appear like the chihuahua on the left that is struggling to wake up compared to your competitors, because they are competing for the grant, who are being more responsive than you. So compliance, if you aren't compliant, you're going to get knocked out. So you need to have the correct EIN, for example, UEI from SAM. Ensure your organization is eligible. So if you're a vendor, you need to be partnering with an Alaska organization. and don't go over the character limits. I don't think it's possible on the forum that they have in Alaska, but don't go hideously under either, because the character limit is there as a guideline for how many characters you should write. I will say that it seems that because it's a letter of interest, it's not going to be as strict as a usual RFP process, where some agencies will just cut you out if you have one word over, for example. This is the state and the Alaska Community Foundation trying to see what's out there and then put people in certain buckets. But I think it represents you really well whenever you are compliant, particularly on that UEI. They've stressed that a few times. And if you make your application and say, "Oh no, we don't have the UEI yet," it shows that maybe you've been a little bit late to the game, or haven't been taking things at the right pace and left it to the last minute. Responsiveness is the important one. Then I want to bring back in Dr. Fitzmaurice. And that's really about directly addressing specific goals, priorities, etc. So, as I mentioned, this fund is meant to transform rural healthcare long term. You don't want to propose something that isn't feasible right now just because it's not economically viable, because that's not going to be economically viable in 5 years, probably. You need to show that there's a gap in service offering right now, and your program can come in, fill that over the long term. Involving community partners is a great way to do this, because it shows that the system is taking part, and if there's a piece of slack from one provider or the other, then someone else in the system can bring that up. So without naming names, Dr. Fitzmaurice, I know you've been doing a bit of outreach on behalf of one of our clients for partnerships. How did you go about it really? What should organizations do to get these pre-partnerships for their letter of interest?
Well, it really, so again, going back to what you said is so critical, because is there a need for what you're proposing? Don't just try and propose something to get money. Are you trying to fix a need in your community? And is there any kind of data to support, wow, this is lacking? Because we are going to use that for how we implement the program and track it, to see the outcomes from the program that you put together. So we all have to have something to measure. That's going to be very important. And then that is just something that we have on the initial call to discuss, hey, what are you looking to achieve? And then we can kind of brainstorm. If you haven't thought of partners already, that's when we sort of think about, okay, well, these are your goals. Let's see, who can we work with to align with what your goals are. So again, that's sometimes that's during the initial evaluation with us, that we kind of brainstorm session and look and see what you're trying to achieve. Other people have already thought that out, but that is important to identify if there are any potential, because then you can reach out, or we can sometimes reach out and develop those partnerships along with you. So that is critical.
Yeah. And it's not as hard as it seems, actually. I think people do want to help each other. And if you don't have any partnerships at this stage, then yeah, don't be afraid. Don't let it discourage you. And Dr. Fitzmaurice is a very persuasive manner. So if you need a bit of help, you can reach out to him.
Well, and also it's when you think about partnerships, a lot of times those partners, they want to help out because they are involved with that need in some capacity. So you all are coming to the same conclusion. You all want the same goal. You're just working together to achieve it. So when we talk about partnerships, a lot of it is really actually pretty easy, because when it's presented the right way, yes, you all are in alignment with whatever goal you're trying to achieve typically.
Yeah, absolutely. And I think one thing that we learned from our work with search, so we were advertising in the lower 48 to get nurses to move to Sitka, or doctors, physical therapists, was when it comes to recruitment within Alaska, well, you have two options. You have relocation or growing your own workforce. when it comes to relocation, really selling the area and the natural beauty of the place is what works because it's a lifestyle choice. And I think bearing in mind the people that we were trying to get to move that were coming from Texas, California, states with drastically different weather, social, cultural environments, we were keeping in mind all the time, what are these people struggling with and how can we help them? So that's why with our clients, we take that same approach when it comes to devising their programs. How, well, first of all, what's the state struggling with and how can we help them? And how do we put that in the proposal? And then when it comes to a workforce component or public health communication component, how are we going to actually get people into this program? And if you're writing your proposal, I think you really need to consider that. What are you going to do to engage the public and get them involved? It's not like build it and they will come. These days, you're really competing for attention with a variety of social media accounts and news articles. And we have found that like helping our clients understand that and coming in with a program that they can partner with us on is very useful. Wondering if you've seen any other areas that people might not think that they will struggle with, but they should keep in mind if they're going to be going for this.
Um, I just, the first thing is really, is there a need? Because, and honestly, that's where it's good to brainstorm with us because some people have an idea and it may not align with exactly, what the state guidelines are. Most people, though, they come up with an idea and it does. It's really dependent on, there's so many variables involved. It really depends on what they're looking to achieve. Certainly a lot of the people have had struggles with workforce. So when we do get to talk with clients and let them know our background, and this isn't, it's such an easy task as here enticing them with a little incentive bonus, because we all know that doesn't work. There has to be a lot more thought involved in how to attract and keep. That's the other thing, keep workforce. When you have these needs and you need a workforce, you don't want to spend money on training them and then a couple of years later they're gone. You want to get them involved with the community in lots of ways that we know how to, so they are passionate about that and they want to stay. They have become a part of that community, and they don't want to leave anymore. So those are all critical components. But yeah, there's so many variables. It really depends on what exactly the particular client's goals are.
Yeah. No, and I think that's the beauty of this program. Like, it is flexible. You have to stay in the categories, but you can propose an innovative solution because that's what rural health needs. It needs like new ideas, and the money's finally here to fund it. So, gonna close out now, but wanted to leave everybody on a few things. So the first is, if you're going through a proposal right now and you want a bit of support in coming up with a program or implementing your program, as I mentioned, that we help healthcare providers build out what that program looks like, assist with project management, strategic level. We help with workforce recruitment. We also help with public health communications. Do reach out to us. You can reach me on LinkedIn, Adam Chambers, or Dr. Fitzmaurice, Dr. Mike Fitzmaurice. And even if you're going for this alone, we'd love to share ideas. And we've already linked a couple of organizations up as partners. And we think that's beneficial to everyone. So we'd love to start a conversation here and try and help those on this webinar, listen to this webinar, win these funds. So it'd be great to hear from y'all and see what ideas you have. Do you have any parting comments before we go, Dr. Fitzmaurice?
No, it's good just to, whatever ideas you have. Some people have an idea and they I don't know, I was thinking about this. It turns out to be a really great idea that I think has a strong chance of getting funding. And then other people, like I said, they have a really strong laid out plan. They just really need help working with it and fitting it into this structure to make sure they have the best chance of getting funded. But it's certainly worth a brainstorming session and we could discuss it. We have a lot of knowledge in what is needed. So that initial discussion can at least figure out the path that's best for them. Yeah.
Yeah. Well, great. Thank you so much for sharing your insights today. We'll probably do another one of these as the progress goes on. The deadline is the 11th of March to fill in one of these. And yeah, I think I was just listening to one of the recordings there, and they said that April would be a expected date to start some of these grants. So things are moving fast, and we're really excited to see how it plays out. So thanks everyone for joining, and I wish you well with writing your application. See you soon.